So the idea of retiree health care is something that we take seriously. We understand that it's confusing. Okay? I've done hundreds of these meetings, and I know that people hate change. Everyone tells me the same thing every meeting. Colin, it was working so well before. I hate change. Okay? So we understand that. We are empathetic. We are going to walk you through this process and make sure it's simple and easy for you to do. Okay? We're available to speak with you Monday through Friday from 8 a.m. to 9 p.m. Eastern Time. So feel free to phone us anytime during that period. The actual enrollment, again, takes place over the telephone, electronically. I'm going to ask you questions once we have agreed on a plan that works. We agree on a plan, and I'll say, Mr. Jones, I'm going to start the enrollment now. I'll ask you things like your address, information on your red, white, and blue Medicare card. We'll do all of that over the telephone. If you want your son or your daughter or a neighbor or a trusted individual to be on the phone at the same time, it's absolutely fine. We encourage it. We'll call them if they live in a different city. If your wife or your spouse is in a long-term care facility or they're incapacitated and you're making medical decisions for them, you are welcome to do this process for that individual. You do have to have medical power of attorney to do that. Okay. Like I said just a few minutes ago, all of the phone calls are recorded. It's to protect you and our company as well. The red, white, and blue Medicare card is an important piece of information to have. So if you don't have this, let us know. We'll call Medicare with you and we'll get a new one and we'll help find out the information that's on that card. But it'll have your health insurance claim number. It'll have your Part A and Part B effective dates. It'll have the exact spelling of your name as the government sees it. All those things are important to us. A and B of Original Medicare. Part A covering hospitalization, Part B covering your doctor's office visits, is not changing. You're still going to pay for Part B. It is still your primary coverage. Okay? A and B of Original Medicare remain your primary coverage. What is changing is instead of having a group plan from Battelle that supplements Original Medicare, you will have an individual policy in 2013 from Extend Health. And remember, it'll be one of two different core options. It'll be a Medicare Advantage plan with your drugs built into it, or it'll be a Medicare supplement, also known as a Medigap plan, with a separate Part D drug plan. We'll help you find and evaluate all the plan options. We'll walk you through that entire process. Dental and vision are available as well. Okay, so if you are interested in a dental or vision plan, talk to your benefit advisor about it. The dental and vision plans are preventative type plans. So they cover cleanings and x-rays, routine eye exams. They cover lenses and frames. When we talk about diseases or conditions of the eye, things like macular degeneration, cataracts, glaucoma, or injuries to your jaw or your teeth, those types of medical ailments are covered under both Original Medicare and your supplement plan. They're not preventative, but they're covered actually under your medical plan with full coverage. So remember, one of the options, one of the broad options that you could select for 2013 are what are known as Medicare supplement or Medigap plans. Medigap plans work extremely well for a lot of people. They're very popular. They have no network. So what that means is that if a doctor or a hospital accepts Original Medicare, they will accept a Medigap policy. Okay? So if you have a lot of doctors, or you're traveling, or you live somewhere else 6 months of the year, take a good hard look at these Medigap policies. Very powerful in those cases. How does it work when I go into the doctor or when I go to the hospital? At the doctor or in the hospital, Parts A and B of Original Medicare pay first. Okay? A and B pay first. This Medigap policy will come in and fill in the blanks, fill in the gaps that Original Medicare Parts A and B do not cover. Things like deductibles, co-payments, co-insurance amounts. So it fills in the gaps that A and B of Original Medicare do not cover. You can expect to have a higher monthly plan premium with a Medigap policy. Okay, so you pay more for that policy on a monthly basis. However, when you go to the hospital or when you go to the doctor with a Medigap plan, you're going to have little to no out-of-pocket expenses. And we are all going to take a look at a specific Medigap policy in a second here, and it'll make more sense. Because the Medigap policy does not have prescription drugs built in, remember, it's my responsibility to help you find a drug plan as well. So I'm going to talk to you about the medications you're taking. I'm going to talk to you about the pharmacies that you want to use. I'm going to find out how often and what size of your medications that you're taking. So we look at all of that. Okay? I'll help you find a cost-effective drug plan that allows you to take all the medications that you need to. That's our job. So when we combine those two types of things, when we combine a Medigap plan and a Part D drug plan, we are talking about full, comprehensive coverage. Maybe we get on the telephone and she tells me that the Medigap plan sounds great, Colin, but it doesn't work for me. That's not what I want. I talked to my neighbor, and my neighbor told me that this plan, this Medicare Advantage plan, was going to work better for me. So we'll take a minute and we'll talk about Medicare Advantage plans. That's your second core option that you can choose from for 2013. Okay. A Medicare Advantage plan is an all-inclusive, comprehensive policy. It covers your doctors, your hospitals, and your drugs all in one plan. The plan is network-based. So in most cases, it'll be a PPO-type plan or an HMO-type plan. What does that mean to you? It means that I'm going to find out who your doctors are. I'm going to find out what hospitals you want to use. And before we even talk about a specific Medicare Advantage example, I'm going to make sure that your doctors and hospitals accept that type of plan. So we're never going to get on the telephone and have you enroll in a policy that your doctors and hospitals don't accept. Okay? That's not what we do. All right? It's my job, using the tools and training I have, to help find a Medicare Advantage plan, if it's right for you, that your doctors and hospitals accept. Okay? So don't worry about losing doctors or losing hospitals. It's our job to take care of those things. With a Medicare Advantage plan, you can expect to pay a lower monthly plan premium than you would with a Medigap policy. So as far as premiums go, it's less expensive than a Medigap policy. However, with a Medicare Advantage plan, when you go to the doctor or when you go to the hospital, you will have out-of-pocket expenses. You might pay $15 or $20 to see your primary care doctor. You might pay $40 to see a specialist. Okay? You might have a $250 copay for the first 5 days in the hospital. It depends on the exact plan that you select, but you will have out-of-pocket expenses with Medicare Advantage policies. And again, I'll have an exact example here in a minute so you'll better understand. Medicare prescription drug coverage. I can tell you that as far as the medical plans go, these Medigap plans and these Medicare Advantage plans, compared to your group health care plan, they're going to be as robust, if not more so, and in most cases, much less expensive. Okay? However, there is a fundamental difference between your group health care plan as it relates to prescription drugs when we compare it to the individual market. So the individual plans that we're talking about today function a little bit differently than they do in your group health care plan. There's no need to write any of these numbers down. No need to memorize any of this. No one is expected to leave here today with an understanding of the different phases of coverage or how the donut hole works or any of that. Don't worry about how much you think your drugs cost and how it's going to impact you. Let the benefit advisors take care of that. And that's really our job. Okay. So here's how it works. I take a retiree and we get on the phone and we have our discussion, and he and I evaluate what's important to him. He says, Colin, I've got a few doctors. We live in Arizona for 3 months of the year, so on and so forth. And I say, great. I think this Anthem Blue Cross Blue Shield Medigap plan along with this Humana drug plan is going to work well for you. And he says, great, Colin, that sounds good. And I'm going to help him enroll in that plan. Remember, I take care of that. The benefit advisor will. On January 10th, when he goes to the pharmacy for the first time, from $0 up until the actual cost of his medications reaches $2,970, he is going to pay co-pays for his medications. Maybe $5 or $6 for generics, between $20 and $40 for brand name medications, something like that. So it's just a very basic co-pay structure up front. Probably similar to the group plan you've got now. Okay. 60% of you are never going to leave this initial coverage phase. You'll stay in there the entire year. Okay. For 40% of you, the actual costs of your medication will exceed $2,970. Once the actual cost of your drugs exceeds $2,970, you have met the coverage gap or the donut hole. And it marks a transition for you, the retiree, from paying basic co-pays to absorbing more of the cost of your medications. It's no fun. The coverage gap or donut hole is not something to be excited about. But let's walk through how it works if you actually had to get into that coverage gap or donut hole. If you're taking a brand name medication, and we'll say you're taking Advair, a brand name medication for asthma. And for our purposes today, we assume that the actual cost of Advair is $100. It's probably way more than that. But let's assume the actual cost is $100. In this coverage gap or donut hole, it says that you pay for 47.5% of the cost of your brand name drugs. So if Advair is $100, you're going to pay $47.50. If you take Simvastatin, a generic medication, you are paying for 79% of the cost of your generic medications. And if we assume that Simvastatin costs $10, then you'll pay for $7.90 of the cost of your Simvastatin. So you're absorbing more of the cost of your drugs in this coverage gap or donut hole. If during this initial coverage phase between the copays you pay and down here and your cost sharing down here, if out of your pocket you ever spend more than $4,750 on drugs, you come out of that coverage gap or donut hole and into what we call catastrophic coverage. It's the final phase of the drug tiered plan, basically. It says that it just limits any additional exposure for the cost of prescription medications. You'll pay $2.65 for generic drugs from that point forward, $6.60 for brand name medications, or a 5% coinsurance, whichever is greater.